If you have an elderly parent, grandparent, or someone close to you who's getting older, pay close attention. In this video, we're going to reveal 5 subtle signs that may indicate an elderly loved one is in their final year of life, clues that often go unnoticed until it's too late. Many people assume that when someone in old age passes away, it happens suddenly, but the truth is the body usually gives quiet warnings, sometimes months, even a year in advance. These changes can seem like just getting older, but they often signal that the body is starting to shut down. Recognizing these signs early won't change the outcome of it. It can change everything about how you support them through this time. You'll have the chance to provide better care, create lasting memories, and ensure they are surrounded by dignity, peace, and love. So stay with us. These 5 signs could help you make the most of the time that's left and bring you clarity, comfort, and connection when it matters most. Let's begin. Number 1 is noticeable weight loss. One of the earliest and often most overlooked indicators that an elderly person may be in their final year of life is unexpected weight loss. This isn't about shedding a few pounds after a change in diet or lifestyle. It's the kind of slow, steady weight loss that happens without trying. Clothes begin to hang more loosely, belts need new holes, and the person's overall frame starts to appear more frail or diminished. Often families chalk it up to aging, assuming their loved one simply isn't as hungry anymore. But the truth is, this kind of weight loss is rarely benign. In older adults, as the body begins to decline, it naturally becomes less efficient at processing nutrients. Even if your loved one is eating regularly, their body may no longer be absorbing the essential vitamins, minerals, and proteins it needs. This can lead to a loss of muscle mass, not just fat. Losing muscle is particularly dangerous in older adults, as it reduces strength, balance, and mobility, significantly increasing the risk of falls and fractures. A weaker immune system often follows, making it harder for the body to fight off infections or recover from illness. Appetite changes are another major factor. The body's internal signals that prompt hunger start to fade. Sense of taste and smell may dull, making food less appealing. Chewing or swallowing may become more difficult, or meals may feel like a chore as organs slowly begin to shut down. The body conserves energy and stops prioritizing digestion. This leads to smaller portions, skipped meals, and an overall disinterest in food. Underlying medical issues can also play a role. Conditions like cancer, kidney disease, heart failure, or undiagnosed infections often cause gradual weight loss before more serious symptoms emerge. Even depression or early-stage cognitive decline can contribute to poor eating habits, which accelerates physical decline. Families often try to fix the problem with supplements, shakes, or favorite meals, but if the weight continues to drop despite these efforts, it's important to recognize that this may not be something that can be reversed. Instead of focusing on forcing meals, the best approach is comfort. Offer nutrient-rich, easy to eat foods. Focus on hydration and small portions more often. Monitor changes gently. This kind of compassionate care can make a meaningful difference in quality of life during a sensitive time. Number 2 is deep, persistent fatigue. Fatigue is common in aging, but deep, persistent exhaustion that doesn't improve with rest can be a powerful sign that an elderly person may be entering the final stage of life. This isn't the kind of tiredness that follows a busy day or a poor night's sleep. It's a constant, overwhelming sense of weariness that makes even basic tasks feel draining. Getting out of bed becomes difficult. Activities that once felt simple, like dressing, bathing, or walking across the room, require more energy than the person can give. Even speaking or holding a short conversation can become exhausting. As the body begins to slow down, it shifts its priorities to essential functions. Energy that was once used for movement and alertness is instead preserved for survival. Heart function may decline, resulting in reduced blood flow and oxygen delivery to muscles and organs. Metabolism slows dramatically, and with it the ability to create and use energy. The body, sensing that it no longer needs to maintain its usual level of activity, starts to conserve energy wherever it can. One of the more difficult aspects of this fatigue is its impact on mental and emotional well-being. Elderly individuals may become frustrated by their declining abilities. They might feel embarrassed, ashamed, or discouraged when they're no longer able to do things independently. This can lead to a withdrawal from activities, They once enjoyed or reluctance to ask for help, even when they clearly need it. Over time, this emotional toll can lead to social isolation, which further accelerates both physical and cognitive decline. Sleep patterns may also change. A person may sleep for long hours during the day, then struggle to sleep. At night they might appear drowsy much of the time, or experience brief moments of alertness followed by sudden exhaustion. These patterns reflect the body's declining ability to regulate its internal systems and are common in those nearing the end of life. Families sometimes assume their loved one just needs more exercise or motivation, but encouraging activity at this stage can do more harm than good. Respecting their need for rest, creating a calm environment, and offering gentle support when they're alert is far more beneficial. Listening to the body's signals is crucial, especially when energy becomes a limited and precious resource. Number 3 is cognitive confusion and withdrawal. One of the most noticeable yet often misunderstood signs that an elderly person may be in their final year is a change in cognitive function and social behavior. This can manifest as increasing forgetfulness, difficulty following conversations, or confusion about time, place, or even the identities of familiar people. These changes are often subtle at first and mistaken for ordinary aging, but over time they tend to become more persistent and disruptive. Cognitive decline at this stage is not simply a matter of getting older. As the body prepares for its final phase, the brain, like all other organs, receives less oxygen and fewer nutrients. This can lead to slowed mental processing, impaired memory, and episodes of disorientation. Someone who once managed their own medications, remembered birthdays, or handled routine tasks may now need reminders or assistance. They may start repeating the same questions or stories, forget recent conversations, or struggle to follow a train of thought. In some cases, cognitive shifts come with emotional changes. A once talkative and outgoing person might become quiet, withdrawn, or uninterested in social interaction. They may prefer to sit alone, avoid eye contact, or appear detached from conversations happening around them. This withdrawal is not always a sign of depression, but rather the brain's decreasing capacity to manage stimulation. Loud noises, busy environments, and complex conversations can feel overwhelming, leading the person to retreat into a quieter, more manageable space. Mood swings and behavioral changes can also appear. Some individuals may become more irritable, anxious, or suspicious. Others may seem unusually calm or emotionally flat. These shifts often reflect the brain's inability to regulate emotions in the way it once could. The person may not be fully aware of the changes, which can make them more vulnerable to confusion and distress, especially in unfamiliar situations. Lucid moments can still occur, and families sometimes cling to these as signs of recovery. But these brief periods of clarity are often followed by deeper episodes of confusion, which can feel emotionally jarring for both the person and their loved ones. The inconsistency itself is a sign that the brain is struggling to maintain function. Understanding that these changes are part of the body's natural decline helps families respond with patience rather than frustration. Gentle reassurance, simple conversations, familiar routines, and a calm environment can provide a sense of comfort and security. While communication may become limited, emotional connection remains possible through presence, touch, and tone of voice. Number 4 is more frequent illnesses and slow healing. A noticeable increase in how often an elderly person gets sick, combined with how slowly they recover, can be a strong indicator that their body is entering its final stage of life. The immune system weakens naturally with age, but when the body is nearing the end, this decline becomes much more pronounced. Minor illnesses such as colds, respiratory infections, or urinary tract infections become more frequent, more intense, and harder to bounce back from. Wounds that used to heal within days may now take weeks, and small cuts or bruises might linger without much improvement. You may notice that skin appears more fragile and thinner, bruises form more easily, and even gentle pressure can leave marks. These are outward signs of slower circulation and reduced blood flow, which prevent oxygen and nutrients from efficiently reaching tissues that need repair. Repeated infections are especially common and concerning in this stage. Pneumonia, otitis, oral infections, and skin conditions may occur more regularly, even with preventive care. What's more, these infections may not present in the usual ways. For example, instead of developing a fever or complaining of pain, the person may simply become more tired, more confused, or less responsive. Subtle behavioral changes are often the first clues that something is wrong. Even when medications like antibiotics are given, they may not work as well as they used to. The body's reduced ability to circulate and absorb medication can delay or limit its effectiveness. This often leads to prolonged treatment or the need for stronger medications that come with more side effects. Families may find themselves caught in a cycle of recurring illness, frequent doctor visits, or even hospitalizations that seem to bring little long-term relief. Chronic wounds or pressure sores can also become a concern, especially if the person is less mobile. If small sores on the skin don't heal or keep reopening, it can be a sign that the body's repair mechanisms are shutting down. These wounds can become infected easily and lead to complications that further reduce quality of life for families. It can be tempting to keep trying every possible treatment in hopes of a turnaround, but in many cases, the goal eventually shifts from curing to comforting, providing gentle care, keeping the skin clean and moisturized, supporting hydration, and minimizing physical stress can go a long way in preserving comfort and dignity when the body is no longer able to heal itself as it once did. Asterisk number 5 is changes in breathing or circulation. One of the clearest physical signs that an elderly person may be nearing the final year of life is a noticeable shift in how they breathe and how their circulation functions. These changes are often subtle at first, but gradually become more obvious. As the body continues to slow down, breathing patterns may become irregular, shallower, or more labored even without physical exertion. You might observe pauses between breaths or episodes where the person suddenly breathes rapidly and then slows down again. This kind of breathing pattern, known as Cheyne-Stokes respiration, is common in the final stages of life and can appear weeks or even months in advance. Shortness of breath becomes more frequent and can occur during basic activities like standing, speaking, or sitting upright. Some individuals may begin breathing through their mouth more often or rely on multiple pillows or a recliner to sleep, as lying flat becomes uncomfortable. The sensation of breathlessness, even during periods of rest, can be unsettling for both the person and their loved ones. It often signals that the lungs and heart are not functioning as efficiently as they once did. Fluid may begin to build up in the lungs, causing coughing, wheezing, or a gurgling sound sometimes referred to as the death rattle in later stages. Alongside breathing difficulties, you may also notice changes in circulation. The extremities, fingers, toes, hands, and feet may begin to feel cold to the touch. The skin might take on a bluish or mottled appearance, especially around the nails, lips, or ears. These symptoms result from the body redirecting blood flow to its most vital organs, reducing circulation to the outer areas. This is a natural part of the body conserving energy and preparing for the final transition. As circulation weakens, blood pressure may become lower and more unstable. You may notice that the person becomes dizzy when they try to stand or experiences sudden drops in alertness or energy. In some cases, their pulse may become weaker or more irregular. Another sign that the cardiovascular system is beginning to fail. These physical changes are not usually painful, but can create anxiety or discomfort. Families may want to respond with urgency, but often, comfort is the most appropriate focus. Ensuring the environment is quiet, cool, and restful can ease their breathing. Offering small sips of water, using a humidifier, or providing oxygen, when recommended by healthcare providers, can also help improve comfort without placing extra stress on the body. Before we wrap up, take a quiet moment to think about what these signs might mean, not just as symptoms, but as the body's way of gently signaling a transition. Unexplained weight loss, persistent fatigue, increasing confusion or withdrawal, frequent illnesses, and slow healing, noticeable changes in breathing or circulation. While each of these changes may seem manageable on its own, together they often tell a deeper story, one of the body slowly preparing for its final phase. It's Never easy to face the possibility of losing someone you love, but when you understand what's happening, you're better able to respond with patience, grace, and presence. You can shift your focus from trying to fix what can't be fixed to simply being there listening, comforting, and making each moment count. If someone close to you is showing these signs, remember you're not alone. Many have walked this road before you. With awareness and compassion, you can walk it too with clarity, courage, and love. If this video helped you better understand what your loved one may be going through, please leave a comment below. Share something you've learned or a memory you're grateful for. And if you haven't yet, consider subscribing. Your support helps us continue creating content that informs, supports, and inspires. Thank you for spending this time with us. We wish you strength, peace, and meaningful moments ahead.